Good afternoon. I'm so glad you've joined us. We've got a lot to get to this hour as we take on the topic shedding light on abuse during the COVID-19 pandemic. I'm Sheilah Kast with WYPR. I host our morning interview show here. WYPR is partnering with GBMC Healthcare to present this virtual town hall. In just a minute, I will introduce our three very knowledgeable, very committed guests. I'm hoping you'll want to be part of the conversation too. We're saving the last quarter hour or so for your questions and comments, but you can put them in the chat all through this hour, and some will address as we talk, as we go through our conversation. You can be anonymous in the chat if you'd like to be. The abuse we're talking about this hour is domestic abuse, emotional, mental, and physical abuse between people who live together. A partner hurting someone in a relationship that may very well have begun in love. A parent hurting a child. Sometimes a grown child hurting an older parent. In a radio interview, this would be the point for me to lay out statistics outlining how big the problem is. Hard to do that after a year of pandemic isolation measures. Some people are stuck inside with an abuser, but it may be harder for them to reach out for help. The statistics about reports to police or calls to helplines might be out of sync with previous years. But the three women with me for this town hall work every day with people coping with domestic abuse. Our guests have insights about how to prevent it, how to spot it, and how to support people going through it. So let me introduce them. Laura Clary is a registered nurse, a forensic nurse, a sexual assault nurse examiner, SANE, who manages GBMC's SAFE and domestic violence program. I'm going to ask you to tell us about the SAFE program in a minute, Laura. I want people to know you are certified to care for patients of all ages who have been victims of sexual assault, rape, child abuse or neglect, intimate partner violence, and human trafficking. Laura chairs the Baltimore County Sexual Assault Response Team, and she was named America's Most Amazing Nurse by Prevention Magazine and the Doctor's Television Show. Laura, I'm very glad you're with us.
Thank you for having me.
Let me also welcome Rachel Sy, the Deputy Director of Turnaround Incorporated, which serves adults and children affected by intimate partner violence, sexual assault, and human trafficking. The nonprofit has offices in Towson and Baltimore City and provides counseling, legal services, shelter, and other support to clients. Rachel is an active member of committees and task forces in Maryland that work to address the issue, including the Maryland Human Trafficking Task Force, Coordinated Action Against Sex Trafficking, and the Baltimore City Mayor's Office Human Trafficking Collaborative. Hello, Rachel.
Hi, thank you for having me today.
Thank you for being with us. And rounding out our panel is Ojeda Hall. She is Executive Director for One Love's Maryland, D.C., and Virginia Division, in charge of partnerships and programming. During her tenure with One Love, she initiated a partnership with Baltimore City Schools and enriched its video content and messaging that includes diverse stories and diverse storytellers to better reflect the Baltimore community. Before joining One Love, Ojeda was the Senior Director of Collective Action for Leadership and Educational Equity. Welcome, Ojeda.
It is a delight to be here with these amazing women for Women's History Month. Thank you.
It's a delight to have you. Laura Clary, tell us what SAFE, Sexual Assault Forensic Examination, tell us what the SAFE program does at GBMC.
So the SAFE program is available 24/7, 365 days a year. We are staffed with certified forensic nurse examiners and victim advocates, and we provide advocacy services and medical forensic treatment to victims of sexual assault, domestic violence, child physical and sexual abuse, and human trafficking.
And how do patients come to you, or how do you connect with patients?
So patients get to us numerous ways. Sometimes they are brought in with law enforcement. Sometimes they are referred to us by our community partners, for example, from Turnaround. Sometimes they come in on their own and they enter through the emergency department. And sometimes we get them transferred from other facilities or even primary care providers within the area.
And GBMC also has a child protection team. Is that connected or how is it different?
Yes, so it is connected with the SAFE program. We all work together as one big multidisciplinary team. So whereas the SAFE program has advocates that provide advocacy services, our child protection team has licensed social workers and counselors that specifically respond in for cases of child physical abuse, child sexual abuse, and neglect whenever there is a suspicion or a confirmed case. Really just to make sure that they're connected to the resources that they need to be connected to, making sure that the appropriate mandatory reports have been made, and then working alongside the SAFE program if any kind of medical forensic treatment is needed.
Thank you. Oh, Jada, what should we know about One Love?
Thank you for asking. I think, especially after listening to my colleague, One Love is a prevention approach to ending intimate partner violence and relationship abuse. We were founded in the wake of a tragedy, a Baltimore native, Yardley Love, who sadly was killed during her college, just before she graduated from college, really. And her family committed to do whatever they could to prevent this from happening to anyone else. So One Love's mission, our core purpose, is to change the statistics that you're going to talk about in a little bit and the norms in our society that allow for relationship abuse, and build a world where all of us, especially young people in our communities, can learn to love better. We, by some accounts, are the nation's largest youth education, healthy relationship education organization. And we've educated about 1.4 million people, mostly young people, in our content around the healthy signs of a relationship and maybe more importantly, the unhealthy signs and how you know when you're in an unhealthy relationship that could escalate.
Yeah, I definitely want to talk more about that in a bit. Rachel, tell us about Turnaround. What does Turnaround do?
Sure. Thank you. So Turnaround is the designated rape crisis center in Baltimore City and Baltimore County. And we support survivors of sexual assault, but oftentimes survivors have multiple victimizations. So we also support survivors of intimate partner violence, which is also known as domestic violence. And in 2011, we expanded our services to also serve survivors of human trafficking. Our services are 100% free and is comprehensive, which basically means that we have various options for survivors to access, including immediate assistance to explore shelter options so that they can have a safe and immediate place to go, our trauma therapy services, our case management services that will assist them with various referrals that they might need to help them improve their overall situation and increase their self-sufficiency. And we also have legal assistance for survivors to help them navigate the court system and obtain protective orders, for example. And our goal basically is to educate, advocate for, and empower all people that are impacted by this type of violence. And we ultimately want to end this type of violence, the cycle of violence. And you cannot do that without also addressing the issues at the abuser level. And so Turnaround also offers an abuser's intervention program. Like One Love, we also have some prevention services where we have a community engagement team that also goes out into the community to educate people on the different types of victimizations that we're here to talk about. So they do a lot of work with different audiences in the community to address this issue as well.
Thank you. Laura, what stands out to you about what you have heard from clients, or about the injuries that you have treated over the past 12 months?
So COVID-19 was something that none of us saw coming. None of us were prepared for. So when we started seeing things shut down, schools shutting down, different agencies shutting down, people working from home, the thing that stood out to us the most was knowing that people were going to be stuck at home with their abuser. They were going to be stuck at home without a safe way to get in and to see us. And we also know that COVID caused a lot of different stressors in people's lives, financial stressors and childcare stressors. And these stressors cause, our domestic violence situations, our child abuse situations to escalate. So unfortunately, when we were seeing patients coming in, we were seeing a lot more significant injuries, a lot more severe injuries than we had seen previously. We knew that kids that would normally have a safe place to go, at least for a few hours during the day when they would go to school, they no longer had that. So we started seeing an increase in, child sexual abuse because these kids were stuck at home with their abusers. Now that things are starting to open back up, we do anticipate seeing more cases coming forward because now people feel safer coming into the hospital. So we had to make some adjustments. We had to make sure that patients knew that we were still available 24/7. We know that these crimes don't stop during a pandemic. So it was our goal to make sure our advocacy services and our forensic nursing services were available around the clock with face-to-face interventions.
Oh, Jada, what have you heard from young people over the course of the pandemic year?
Yeah, so much of what has already been talked about, but relationships can intensify during COVID-19 when you can't get out of the house. They can escalate much faster than during our normal time. So we heard, as I talked about, One Love is about the 10 signs. A lot of people expected a young person, for example, to answer their phones and respond quickly to text messages or spend all day online. Some of the issues that we saw were that unhealthy relationships really looked differently during COVID. So manipulation, using shelter in place to prevent someone from leaving activities or pressuring someone to meet up. We heard that from students. And then we heard a lot from educators who were saying that the times that they would normally use to teach people healthy relationships, those school times were all over the place at this point. And they were beginning to see that so many of our students needed more mental health support, more social emotional learning support, that we really needed to do our work with a greater trauma-informed lens, and that young people really need this kind of education now more than ever. This is the time when we really need to be doing prevention-related education and helping people to distinguish, just to know and have a language. We really heard young people need the language to understand whether their relationships are healthy or not. And honestly, that some are seeing unhealthy relationships in their households as well. So we have to figure that out.
That's a lot. Rachel, what have you heard from clients about how the pandemic affected their relationships?
Well, I would definitely echo some of the things that were mentioned by Laura at GBMC in terms of what we have been hearing or seeing is the intensity or the severity of the cases that are coming in. And so more survivors are being more severely injured, such as strangulation, or stories where they're being captive at home, especially when you're in a lockdown situation during the pandemic, receiving injuries or needing medical attention and being denied access to seek medical services by their abuser. And in those times, survivors were definitely in a more desperate need to get help in ways that they could. And so they were even willing to take risk out of desperation to try to get access to services and resources. And so we heard of stories where survivors are trying to get creative in ways that they could while at home with abusers, making an excuse to take a walk so that they could make a call, going into another room to try to make a call. So, and hoping that the abuser who might be in the next room would not hear them, for example. And so we've seen an increase in terms of what was happening, which definitely increased our volume in general. But we've also seen, survivors in a more desperate situation, really trying to get out and trying to get help.
You and Laura both mentioned more severe injuries. Why do you think that's the case? Rachel?
So
it's a great question in terms of the why. I think the one thing how I would explain it is the abuse already existed. And when I say this very carefully to not say anything that would promote an excuse or a reason for an abuser to do what they do. And so under a pandemic, where something is going on and everyone's at home, it's tense. And then you have additional factors where people are losing jobs, there's income concerns or, whatever the case might look like. Mental health, being impacted or spiking, because of what's going on regarding the pandemic. And so it can just exacerbate an existing situation or exacerbate, an abusive situation to really intensify it. And so that's what I would believe.
Laura, is there anything you'd add to that?
So I agree with everything that Rachel said about the increased stressors. And I also think that, especially in the beginning of the pandemic, hospitals were a really scary place for people to come to. So I think many abusers knew that the person they were abusing wasn't going to come to the hospital. So again, just doing a lot of things that we could do to make sure that patients knew we were still available. And making our services more available and a little bit more victim-centered and friendly for these patients, because the hospital was a really scary place for a while for people to come into because they were scared of being exposed to the virus.
Well, and also I presume a hospital in particular had to take a lot of precautions to keep COVID-19 from spreading. So tell us more about how you adapted what you do, what you're doing now that you weren't doing, 13 months ago.
So we, again, recognize that patients were afraid to come in for treatment. If anybody had to unfortunately go to a hospital, especially during the beginning of the pandemic, and you saw the tents that were set up outside of all of the emergency departments, it could be really scary for somebody, especially for someone who's already suffered a trauma. And it took a lot for them to even come to the hospital. And then they see these tents and they don't know what to expect on the other side. So we knew that our patients, were afraid to come in and see us. So what we did was we worked with our emergency department team. We worked with our leadership team in the hospital. We worked with our community partners and law enforcement to say, hey, what can we do to make this service more accessible so that patients aren't afraid to come in and seek treatment? So all of us collaborating and figuring out a way that we could alter our workflow so that they could come directly to the Safe Suite when appropriate. Our Safe Suite is separate from our emergency department with a private entrance. It is a completely secure and locked down suite. And we could meet the patient outside of our suite, do a brief triage, do a COVID screening, and then bring them in for treatment, bypassing the emergency department. Our goal was to keep healthy people out of the ER during the COVID-19 pandemic. And we worked again very closely with our emergency department and our pediatric department, and we developed a telehealth medical screening system so that when the patient was in the safe unit, they could still have an interaction with a physician to ensure that they're getting that medical screening that is required as well.
Let me just remind folks that we are interested in your questions. You can put them in the chat. You can create a name for yourself. You don't have to use your real name, and you can type a question in the chat. We're monitoring the questions, and we'll try to get to as many as possible. Ojeda, you told us that One Love's outreach depends almost entirely, or at least that was my impression, on educating students in classrooms. And of course, most students haven't been in school for much of the past year. How are you getting through to them?
It's really incredible that we've been able to activate a core of volunteers. We have the Mid-Atlantic Volunteer Network, where young people are increasingly joining because they don't have a lot to do. They didn't have a lot to do early in the pandemic. Some were bored, some were looking for volunteer opportunities. And One Love is really a passion for so many young people. We were surprised. We're continually surprised that of the stories that young people have about experiences with unhealthy relationships and abusive relationships. And we even did an Instagram Live series where some young people came on and told some of their stories. We did over 20 Instagram Lives, just getting into the community to hear what's happening. But we have 150 volunteers that have been activated, and they are finding ways to bring One Love to their sports teams when sports start back up, or just talk to their friends. We hear over and over again that young people need language because it can be hard. They feel like they're butting into conversations when they're trying to help friends. And so we also worked a lot with more community-based organizations. And the biggest thing that we did was really go internal, pivot, which so many organizations had to do. And we really exploded and expanded our online presence. So if you go to www.joinonelove.org, there is an education center. I can't even get it out. I'm so excited about it. There is an education center that is replete with 140 different pieces of content that young people can access, their parents can access, their teachers can access for professional development. It's been filtered by middle school content, high school content. Volunteers can access it. And so now for free, anyone can sign in and really get an account to start working through some of the dynamic, fun, engaging lessons that we have fundamentally to teach people, here's the difference between a healthy relationship and an unhealthy relationship. And here's how you identify the warning signs. And I'll just say lastly, surprisingly, we've reached 23,000 young people over the last few months when we didn't expect to reach many. And that's been because educators, once they were able to get their heads above water, came back to One Love and said, the content works, we can plug it in.
That collection of resources didn't exist when the pandemic started?
Such a great question. So it existed in different forms in different places. But what the pandemic allowed us to do was to organize it all, put it together as a one-stop shop. We're actually in production on 10 new pieces of video content, because when we talk about meeting young people where they are, we're talking about young people are on social media. They're on Instagram, they're on TikTok, they're on Snapchat. They are learning to date on Snapchat. They are meeting on game apps. And so we've done so much creation around the 10 signs and popular culture. So yes, we had to bring it all together. We had to add new content so that we could reach even more diverse communities. I'm so proud of the work we've done to reach LGBTQ communities. We've added Amor del Bueno, which is a Latinx film created by Latinx students for Latinx folks and for all of us. We're in the middle of working with a great organization, Wide Angle Youth Media in Baltimore, to create content that looks like kids from Baltimore City schools. So it's just been an explosion of creativity for us.
Rachel, Turnaround experienced an increase in calls for help over the past year, right? I'm curious about what changes a significant increase. What changes did you make in order to serve new as well as existing clients?
Well, during the pandemic, one of the things for turnaround, we are very hands-on, seeing people in person, providing therapy in person, very hands-on, and we want to make sure that we are there and observe and support survivors. And so we never imagined that we could do victim services 100% remotely, but obviously we had no choice. So we had to adapt our office spaces, physical office spaces, because of the mandate were closed to staff as well as the public. And so we had to figure it out very quickly within a very short period of time of doing the work remotely. And so creating policies and procedures around doing the work remotely and supporting staff to do the work differently from what we were doing. So some of the adjustments that we talked about. So trauma therapy services, we were planning to incorporate doing some form of virtual, but again, not necessarily 100% during that time. So we had to very quickly adjust and adapt to serve survivors with the understanding that all survivors do not have access to virtual devices, and it may not be safe to do so in their homes. When the abuser is around or may come back in any moment. So for trauma therapy, there was an initial phase of doing the work on the phone, adapting to doing it virtually, on safe platforms so that confidentiality or security breaches, could not occur. One of our tough decisions we had to make was to close our physical shelter space. Naturally, a lot of staff were either vulnerable or concerned about having the disease spread to their family members in their home. So we had to make that decision. But through the pandemic, we were also able to look at leveraging resources, connecting with partners that also provide services. What services do you have that we don't? What are some impacts on your program, and vice versa? And how can we collectively come together so that we can continue to offer full support and full services in the way that we had to during the pandemic, so that survivors could get the things that they needed to get.
And Rachel, Maryland's courts were closed at different points over the past 12 months. How did that affect your clients?
Sure. So we partner with Maryland Legal Aid, which is a free service to the general public. And so we definitely stay connected to them to hear about, what was the status of the court, what was going on, how can survivors, file for protective orders, or are protective order hearings being heard in person? Are they being done over the phone? And for our staff who act as advocates, one of the things that happened was courts did not allow for that victim advocate support or those supporters to come to court with survivors. And so they were only allowing the attorneys, when they did kind of soften it up a little bit, for people to come in court. So the attorney could come, but not that victim advocate, the one that's trying to be there to support the survivor. So again, naturally, that was really hard to do, but we had to adjust and talk to the survivor in advance, make sure they had a plan, offer as much support in advance as we could, since no one else was going to be allowed to come in court. So, but in general, we have stayed in communication with our Maryland Legal Aid partners so that we can hear the latest of what's going on with the courts, so that we know how to adjust and adapt to continue to support survivors in ways that we can.
Rachel, I'm going to throw this to you, but it could be that one of our other panelists wants to address it. This is a question from Brianna in chat. Is there a universal symbol or sign that people can use if they're on a video call and trying to let the other person know they need help? For example, I've seen that some say to show your hand and then fold your fingers over your thumb. I don't know this signal. Is that something you can address, Rachel?
The universal signal, no, I'm not familiar with that. But one of the things we do talk about with survivors is establishing some sort of signal or code that would not be obvious to an abuser. So that way they can communicate things, whether it's via text or on a phone call, to alert the other person. So it is very important for them to establish something that would not be recognizable, to an abuser.
You're talking about if they're in communication with someone whom they know, someone where they could have established in advance a signal or a way to communicate.
Correct. If they can do that with their close circles, circles that they support, to establish something like that up front. But when they reach out to turnaround, for example, even via our helpline, one of the things that we also try to do when there is an element of the abuser might be around or might come back, we try to establish right up front, is there a code or a signal that we can establish, again, so that the abuser doesn't know, so that I know that that person entered the room, or I know to stop the conversation, or et cetera.
We're getting some other questions in the chat about relationships, which we're going to talk about right now. Ojeda, you gave us some idea about how you're communicating with students. How do you talk to students about the differences between healthy and unhealthy relationships?
Well, again, our commitment is to meet students where they are. And oftentimes they don't have the language to talk about what is healthy or unhealthy. So what we really do is provide first a language, and we give them the 10 signs through whether it's their community partner. And a big part of our work really is to work through relationships of trust. They may not know me as the executive director or our team of engagement specialists at One Love, but they know their teacher, they know their pastor, they know their community-based leader. So our goal is to train those folks, to train the young people that they know. And the first thing we do is teach them, this is what deflecting responsibility looks like. This is what possessiveness looks like. This is what isolation looks like, belittling, guilting, volatility, betrayal, intensity, manipulation. This is what it looks like during COVID, so that they can have a frame of reference. I got to tell you, if I had this training when I was a young person, my own relationships and first relationship would not have been abusive, because language is often, what is missing in society, and having an agreed upon way of talking about what it is that you're seeing. So we've been able to not only get the 10 signs out through our videos and our content on the Education Center, but we also did a set of listening sessions this during COVID, because, what do you do during COVID? You reach out in as many ways as you can. And we listen to young people, high schoolers, middle schoolers. That's how we learned that they're dating on Snapchat. That's how we learned how difficult it is for them to really enter conversations and start conversations. And really our commitment, what we believe, is that everyone should join us in starting conversations that save lives. So listening sessions, volunteer groups, continuing to push into classrooms. That's what we focused on.
Laura, are there risk factors that can make someone especially vulnerable to abuse?
Yeah, there are definite risk factors. One thing we do say, though, is that these crimes don't discriminate. So we see patients from all walks of life, all different ages, and it does not discriminate based on what type of relationship you have. So like someone said earlier, we are seeing a lot more patients coming in from the LGBTQ community. So everybody could potentially be affected by, relationship violence or child abuse or sexual abuse. So some of the risk factors that we typically see, the LGBTQ community is at a much higher risk of being in these types of abusive relationships. A lot of them may not feel comfortable coming forward and asking for help because they may feel like they're already in a population that people may not look at the same way. So really creating that inclusive environment where everybody feels safe coming forward. Additionally, we see a lot of patients who grew up in abusive households. So that's what That's what they know. That's what love looks like to them. They watched their mother go through it. So that's what they think love is, and that's what they know. So then they end up getting into a relationship like that. We see that a lot when we talk with our at-risk youth groups that say, I never knew this, but it makes sense because I watched this while I was growing up, and this has kind of shaped my relationships into adulthood. So we do see this cycle of violence that occurs throughout the life cycle.
Rachel, a turnaround gives clients lots of choices about the path forward. Um, what might the healing process look like?
Sure. As you said, it definitely is individualized. We strongly support and believe and make sure we implement in our approach self-determination, which is all stemming from empowerment, providing a survivor with options to explore so that they can pick the best path for themselves that makes sense for themselves, and especially if they have children, et cetera. So in terms of what it can look like for us internally, we have therapy, but maybe not everybody wants to try therapy, at least not up front. It can, if you can imagine going through a trauma experience and then talking about it can be very hard for survivors. They may not be ready to explore that route initially. So we have it, but they may not want to connect with that up front. So we talk about the different things that we can help with or help them apply for or get connected to, whether it's regarding safety measures, safety tools, and things of that nature, affordable housing, housing options, housing resources, whether it's rentals or whether it's programming, rapid rehousing, things that they might qualify for, et cetera, employment. Assistance and help and exploration, that's a part of a survivor's journey in terms of having that independence and creating stability and things of that nature. The legal route in terms of if there's certain protections or things that they want to put in place, if there's children, is there child support that needs to be talked about, or custody issues, that need to be addressed at the court system level. And so again, it's just kind of the gamut of options for survivors. And we just kind of talk about them and again, let the survivor lead in terms of selecting the path that makes sense for them.
Laura, what are the misconceptions you think that most people have about abuse, domestic abuse?
So I do think that there is still a lot of victim blaming. We see that with domestic abuse, and we also see it with sexual assault. That we say that rape culture is still very real. That somebody did something that caused this to happen to them. So, he's had a really bad day, so maybe she shouldn't have been, messing with him or, pointing things out with him. So we do see a lot of still blaming the victim for things that happen with them. We see a lot of misconceptions that this only happens to women. Women are the only victims. And we know that that's not true. So we do have male victims of domestic violence and sexual violence. And we're actually starting to see more men coming forward after sexual violence because I think, there's still a stigma out there about male sexual assault, that it doesn't happen or it can't happen. So we're really trying hard, again, to break through these stigmas and to make sure everybody feels safe and that we've created that inclusive environment where people can come forward. I do also think that there are misconceptions about especially seeking treatment, or why didn't they leave? Why didn't they come forward right after something like this happened? And people tend to put themselves in the victim's shoes and say, well, if this happened to me, I would have done X, Y, Z. You can't do that. because everybody has their individual reasons for why they stay. Everyone has their individual reasons for why they didn't come immediately forward. Oftentimes when a victim decides that they're leaving an abusive relationship, it's the most dangerous time in their life when they make that decision to leave. So it's really hard for someone just to be able to pack up their entire life, their kids and everything, and leave that situation. So again, I think taking the blame off of the victim and really not putting so much on the victim and trying to understand, the trauma that these patients have went through.
Oh, Jada, many students are back in school or preparing to return after not seeing their classmates for months. How will your messaging to students change?
I think we all want to create a welcoming environment coming back to school. Listen, we've been in the middle not only of a COVID pandemic, but a racial reckoning. Students are on edge. They are anxious. Some are angry. Some have been abused. I think our message is that healthy relationships benefit everyone, and we need healthy school communities. And so we've been really working closely with school support staff over the last year or so, building our relationships with them and beginning to creatively integrate our lesson plans into the work that school counselors are doing, that social workers are doing, that social emotional learning staff is doing. And that's going to be really, I think, the key, that we all get on the same page, that every child deserves healthy relationships, and that schools are a great place where they can begin to learn some of those key lessons. And I just want to add a piece to the prior question as well. So many people will say that, well, alcohol or substance use also contributed to an abusive relationship. Those do not. It's people's decision to act abusively. So blaming it on alcohol or blaming it on substances is just also inappropriate as well. So we've got a lot of work to do in getting to the people who are touching the touch points of our children every day, whether it's parents, community-based organizations that are doing after-school programs, whether it's congregations, synagogues, mosques, temples, or our school system. All of us need to be on the same page to meet young people where they are and meet their needs around healthy relationships.
Rachel, we've got a couple of questions that I would like to see whether you can address. Mish writes, what should you do when a victim confides, which may be a first step, and asks that you not tell anyone? And Samantha asks, what is the best approach if you suspect your friend is in an abusive marriage? So, I mean, I guess I'm really asking, what signs of abuse should a friend, a relative look for, and how can they respond?
Sure. Thanks so much for the question. So have a few thoughts. So in terms of what signs of abuse that someone could look for, I think the obvious is the physical, whether you're seeing marks, bruises, hearing about broken bones and things of that nature in someone that you are friends or family members of, or attempts to try to cover up or mask certain bruises. So I think the physical is a little bit more obvious in terms of signs of abuse or something else is going on. It's also been talked about earlier through Laura in particular about other signs that may not be so obvious in terms of actions of control. So if you are either experiencing or hearing about a lot of things that would be examples of control over money, control over what you wear or what you eat, or if you get an allowance, or where you go, or things of that nature, or hearing that someone is being threatened in various forms, whether it's with a weapon or verbally to do harm, etc. And just really like possessive behavior in terms of creating that, I guess, isolation for that survivor. You used to be very close, and they used to be outgoing, and they used to go to family functions, and now, they're spending a lot of time away from people or things that they were used to doing. And so those could be some of the signs, and there's many, many more signs that you can also look up on the Maryland Network Against domestic violence or the national hotline for domestic violence if you want some more signs. But in terms of what to do if someone either confides or if you're seeing things, the first most important thing is regarding your reaction, is to be there, to listen, to acknowledge that you believe them, obviously that you are here to support them, but to find out what they want to do. I think a lot of times as helpers, we might just want to end the thing or, just have it be done with. And certain dynamics is not as simple as that. It really is important to understand what they want to do and how they want to do it. You can, as a supporter, educate yourself, tap into some of the resources, have some of those resources tangible. You can call a victim service provider, such as Turnaround, for example, to find out how can I support someone if you're really not sure what to do. But it's really important to listen, to be there, but to work with the survivor and not take the lead for the survivor.
So if someone experiencing domestic abuse says, I'm telling you, but don't tell anyone, don't try to change their mind on that. Talk to them and see where they want to, what next step they want to take after you give them whatever resources you can.
Absolutely, absolutely. Maybe find out, what is the concern? What are you concerned about if you do tell someone? Have a dialogue about that, and maybe you would better understand. But absolutely, don't act without their lead, support, or permission.
And by the way, we are putting resources and helplines and websites into the chat, so you can get them there. We will also post them on Facebook along with the video of this town hall. And we're looking for your questions there in chat too. You can type them in. I've forgotten where I wanted to go here. I know, it's Carrie's question. What can the average person do to help other than looking for warning signs in those we know? Laura, it sort of picks up where Rachel took us. What else can people do?
So I guess just kind of to piggyback off of what Rachel said, I mean, these crimes are all about power and control that one person has over another person. So our goal, at least from the nursing standpoint, is to make sure that we give a little bit of control back to patients that are seeking treatment. So as a supporter, if somebody comes to you or if you suspect it, again, just being that good supporter, letting them know that you believe them, letting them know that they don't deserve this, and knowing your resources, again, in the community, knowing different things that you can tell them, hey, when you are ready, here's some resources for you to look into. We all want to think that we could be the best supporter out there, but we may not be equipped to handle all of the mental health issues and other things that come along with these really complicated situations. And again, if somebody confides in you something like this, understand what an honor that is, because you may be the only person that they've ever told this to. So understand what an honor it is to get that information from somebody, and know that it's your job to believe them, and that they trust you. So, like Rachel said, you don't want to betray that trust, because then that friend might not come back to you in the future when they really need more help.
Oh, Jada, we're getting questions for you in particular. Angela asks, will One Love keep all the new digital elements post-COVID? I know the technology aspect is important in connecting for young people. And Louise asks, does One Love have information for parents to help their children navigate relationships?
Yes. Let me deal with the second question first. The answer is yes. We have a guide to how to start the conversation with your young person. We hope that the work that we're doing eventually in some generation will put all of us out of business, because we will all know how to identify the signs. We recently have put together an LGBTQ, if you're a parent of an LGBTQ student, We want you to be able to start the conversation and really understand the unusual pressures that LGBTQ plus identifying young people face. So yes, if you go on our website, there's literally a filter for parents and for adults. There's a filter for adults, and it'll go into a number of the resources we have available for parents. The answer to the first question, we are digital from here on out. We are increasingly inviting people to give us feedback on all of the content that is online. It is expansive, and it's only growing. And it only gets better if we get feedback from community members saying, this works for me, this doesn't work. I'm really proud that we've begun translating our content into Chinese and into Spanish. We've made our content accessible over COVID. We really stepped back and said, do we have the right closed captioning? Are people of all abilities able to, and people who have disabilities able to connect? And so we've made those adjustments. So the answer is yes, yes, and yes.
Laura, let me sort of belatedly follow up on what you were saying about honoring the confidence of someone who turns to you. How is that different when you're talking about a child being abused?
So we handle child abuse very differently. A child is vulnerable. The person that they're being abused by most likely is somebody that they rely on for survival and is responsible for their overall care and their overall health and wellness. So from our medical standpoint, if we suspect that a child is being abused, we automatically know that it is our responsibility both ethically and legally to make sure that we involve the proper authorities and make sure that reports are made. We handle children very, very differently than we handle our adult patients that come in. So child abuse is kind of a whole different, we could talk for a whole hour about the different aspects of child abuse and how we care for kids that come through. But reporting, whereas we say with adults and even our adolescent patients, when it comes to dating violence and things like that, we allow the victim obviously to have control over, what route they want to go with their healthcare, the reporting aspect, whether or not we're able to provide their information to our community partners like Turnaround for follow-up and long-term counseling. With kids, the answer is it's very straightforward. It is our legal responsibility and our ethical responsibility to make sure that that child is protected and has a safe place to live.
And what is the age cutoff? Because some kids start dating early. I mean, who is a child and who isn't?
So typically when we talk about kids, we don't necessarily talk about an age cutoff. What we talk about when it comes to reporting is the abusive situation and who the abuser is. So dating violence, when it comes to your teenagers, your adolescents that are in dating violent relationships, that's very different than child abuse. Child abuse specifically relates to care and custody relationships. So it specifically relates to somebody who has direct supervision and responsibility for caring for that child. So that would be a parent, someone who lives in the home, a family member, a coach, a teacher, anyone that has that supervision and is responsible for making sure that that child is safe. So that is specifically what abuse is, and that goes all the way up to 17. When it comes to dating violence, again, even teenagers that come in to see us have complete control over their healthcare and their reporting and being able to be anonymous to come in and seek treatment. The last thing we want is for, a teenager to be scared to come forward to seek treatment. So we respect their autonomy. We respect the fact that they have privacy as well. And we handle those situations very, very differently than we would handle a child abuse situation.
Rachel, as we move forward into recovery from the pandemic, what resources and services do survivors need, especially at this time?
That's an awesome question. And so for survivors of intimate partner violence, domestic violence in particular, and I'm speaking about adults in particular, having access to affordable housing, which is something I mentioned prior. Affordable housing systems that can create programming that will consist of shelter diversion, so that survivors don't necessarily have to have a shelter as their first option, for safety. Employment, career options, so that they can support themselves. Funding to help prevent evictions, or utility assistance, those things, so that they can stay in their homes if they have places to be, as well as that legal support that I mentioned prior, to help protect them from the abuser, that realm. Developing safety plans. So as they are coming out of the pandemic, and services are more accessible, creating those safety plans that we talked about, to cover different areas. They can be supported by providers like ourselves to do so. And one final thing I wanted to say related to the pandemic, when we talk about access to services and options, definitely want to make sure that we are securing information about vaccine access for survivors. So getting information to them if they so choose to want to be vaccinated to protect them from the coronavirus, would also be something that we would include coming out of this pandemic, information, and making sure that they have access so that they can be safe in the community in general. I think that is something important we need to add to this conversation, because we're all impacted by it.
Good point. Thank you. Ojeda, it can be hard to understand why people don't leave abusive situations. Tell us from your experience, what calculations are they having to make about the risks of leaving?
Yeah, I mean, I know Rachel and Laura see this so often, but it could be a financial consideration. It could be children. It could be what people will say. I think what has been said about not victim blaming is the key. We just don't know what we don't know. The key is to come to our friends in a non-judgmental attitude. Let folks know, your friends know, or your family members, here's what I'm seeing. How is this working for you? How are you? I want you to know I love you. I want you to know I'm here for you. We just don't know all the factors. And we do know how dangerous it is and can be to break up. That is what started One Love, a breakup. So that escalated. And so we have to be very mindful, especially during a time of increased social media usage. People can get access to your locations. People can track you. Safety planning, I agree, is 100% essential.
Laura, another belated follow-up. So should an adult who suspects child abuse call police or call an organization like GBMC?
So they can certainly call if they're just looking for some advice on how to proceed with things. They can certainly call. We have a child protection team here at GBMC that works with a lot of our child abuse cases that come in through the emergency department or come in through the SAFE program. So we're certainly available to help with questions. Obviously, if a child is in immediate danger, if you suspect that a child is in immediate danger and being abused, then absolutely at that point it would be okay to get police involved or your local child protective services. And even from the medical standpoint, it can be really challenging for us because we have our patient, we have the trust of our patients. So oftentimes when people hear of child protective services, they automatically have a negative feeling about that. And sometimes it's not necessarily a bad thing for us to get them involved, even if we are wrong about the abuse. And maybe this family just generally needed some additional help. Maybe they were struggling financially and the abuse didn't come from, an abusive burn, but it came from an unsafe living condition because the family couldn't afford furniture. So the curling iron was on the floor. So there's a lot of different things that we look into and utilize our child protective services representatives and partners to make sure that kids are safe out in the community. But absolutely, if you suspect a child is in immediate danger, then I would definitely contact the authorities.
We are very very close to the end of our hour, and I'm finding it really hard to break off this conversation because I think each of you knows so much and it brings so much. Let me just go around and give each of you 30 seconds to either underscore a point or tell us something that we have missed so far. Ojeda, I'll start with you.
Thank you so much. It's really been an honor to be here with Laura and Rachel, two of the referrals that we send people to. We just think it's really important that people understand the signs, that people are able to set healthy boundaries and know what consent looks like, that you're able to help a friend. You have the skills and the language to be able to help a friend, that you know how to access resources, you know how to have healthy breakups. And I think more importantly, we're doing this so much more. You need skills to have healthy relationships. So we often run out of time, and that's my fault, talking about the healthy skills and signs, but people need to set relationship goals. Everyone deserves a healthy relationship. All of us can learn to love better. That's what we're founded upon, and that's what we'll be doing for the next decade, helping people learn to love better.
Ojeda, thank you. Rachel, what closing thought would you leave us with?
Yes, thank you for having this conversation, and thank you to all of the panelists today. So quickly, I would just say that while we have services to help survivors, it really is a collective movement that still needs to happen in terms of the community, society, et cetera, changing stigma, changing how we respond, changing how we view this type of violence, bringing more voices to the table, including men taking the lead to help shift and change and say that this is wrong. So the more voices that we have and the more eyes on this issue, we can definitely achieve the goal of ending this violence.
Laura Clary, I'd ask you to wrap up with a closing thought.
And I'd also like to say thank you so much for having me today and allowing us to bring this, conversation to the table. And I know that we at GBMC could not do this work without the partnership that we have with One Love and we have with Turnaround. And we all rely on each other to really provide the best care possible for victims in our community. And if I had one thing to say to someone watching this who may be a victim, it would be that you are not alone. And there are a lot of us out there that are here for you. We believe you, and we are available for when you are ready to seek help.
Thank you all. This has been a terrific discussion. I want to remind folks that links and resources are in the chat and will be posted with the video of this town hall on Facebook and on the WYPR website. And of course, thank our guests, Laura Clary of GBMC, Clinical Manager of the SAFE program there, Rachel Tsai, Deputy Director of Turnaround Incorporated, and Ojeda Hall, Executive Director for One Love's Maryland, D.C. and Virginia Division in charge of partnerships and programming. For the technical support that got us all into the same virtual space today, I thank WYPR's Director of Digital Content, Jamila Krempel, WYPR engineer and producer Luke Spicknell, on the record producers Maureen Harvey and Melissa Gear, who kept an eye on the chat along with so much more, as well as GBMC's web and multimedia manager Matt Ellis and digital marketing producer Tyler Sheff. And thanks to all of you who took part in this town hall. And thanks to GBMC Healthcare for its support of WYP.